The second vital sign is pulse. Pulse refers to the pressure wave that expands and recoils arteries when the left ventricle of the heart contracts. It can be palpated at many points throughout the body as shown in figure above. Nursing assistants typically obtain the radial pulse because it is easily accessible. See the image above of a nursing assistant obtaining a radial pulse. To locate the radial pulse, ask the client to hold the palm of their hand upwards. Draw an imaginary line from the extended index finger of the resident past the wrist to the radial bone and then palpate the radial pulse just inside the radial bone. Use your index and third finger when palpating a pulse. Never use the thumb because it has its own pulse, and you may inadvertently count your own heart rate rather than the heart rate of the client. When obtaining a pulse, the patient should be seated comfortably with their arms and legs uncrossed. If the patient is lying down, this may lower their heart rate, so their position should be documented. Pulse is measured in beats per minute. The normal adult pulse rate, heart rate, at rest, is 60 to 100 beats per minute, with different ranges according to age. The pulse rate should be regular, meaning the frequency of the pulsation felt by your fingers is an even tempo with equal intervals between pulsations. However, heart conditions can cause irregularities in heart rate, called arrhythmias. When an irregular pulse is noted, it should be documented and reported to the nurse. It is considered best practice to assess a patient's pulse for a full 60 seconds, especially if there is an irregularity to the rhythm. Heart rate varies greatly from newborns to adults. In general, immediately report an adult's pulse rate that is less than 60 or higher than 100 to the nurse. See the table above for normal heart rate ranges by age.